Hello, this is BioBeat, brought to you by Biotechnology Board here in Pittsburgh, Pennsylvania. I'm Kanak Iyer, co-founder of the board, and our goal is to make Pittsburgh a hub for global partnerships in biotechnology. Today we have a wonderful guest who is going to do just that. And he's a homegrown talent, born, bred here in Pittsburgh. And to introduce him, our very own Bill Flanagan.
All
So,
right,
Bill,
Kanak,
take it.
thank you so much. Appreciate it. Good to be back here with everybody again these days with a really exciting topic for this particular podcast, a great homegrown success story. And we love that on BioBeat. We love to hear about that here in Pittsburgh with Anurag Mehta, who is the CEO and co-founder of Omega Healthcare. And he's going to tell us a lot more about what Omega Healthcare is and what it does and how it does it and where it came about. But by way of, and by the way, hello, welcome.
Thank you, Bill.
Give everybody a little more of a bio here. He's actually has 35 years of U.S. corporate experience, 24 of which have been as a founder and leader of global organizations serving the American healthcare ecosystem. In 2003, he co-founded Omega Healthcare, which is now a leading global revenue cycle management services provider that employs 35,000 people across 4 countries and 11 cities.
Amazing,
That's
yeah.
it.
Really exciting. What
Thank
a journey you have been
Yeah.
on. Yeah.
It's been crazy.
Yeah, we got to. So, okay, I give it the gobbledygook kind of explanation, or the jargony explanation. What is it exactly you all do for your clients, I guess, worldwide?
Yeah, well, actually, the client base is all domestic.
Okay,
right? So
all right.
everything that we do is for the U.S. healthcare industry, and it's mostly for large hospitals and integrated delivery networks, large provider groups. We cover kind of the 3 areas of healthcare, which are the providers, payers, and pharma. So we have the full ecosystem of healthcare. But what we do is we try to take cost out and improve efficiency on the administrative side of healthcare. So we're not on as much really doing much on the clinical side.
Okay.
It's mostly on.
Operational?
Yeah, it's really like healthcare is incredibly inefficient here
Yes.
in this country.
That's what I was telling
I
you.
have heard that. I've experienced a little bit of it over the years. Yeah.
And what we're trying to do is just empower our clients to focus on the clinical aspect of it and not have to worry about the administrative piece of it, because in the United States, we don't have a single payer system, right? A single, like other countries do.
Right. Medicare for all.
Yeah, Medicare for all.
That's the
Yeah.
buzzword,
So
right?
what
Yeah,
we
don't
have,
do that.
what we have is hundreds and even more payers. Everybody's reimbursing at different rates for the same thing, and this is the find an industry where you go in and you do a service. You're a physician. You're seeing a patient. You're not getting paid for until way later, if you get paid at all, right?
Sure.
So that entire process is incredibly cumbersome and complex, and continually gets more and more complex because you have a cat and mouse game, right? You've got the payers that are looking for ways not to pay, and you've got providers that are struggling to get their money. And in these times, it is really, really difficult, right? With increased tariffs and costs going up, and Medicare reimbursements literally being flat or going down in some cases. So there's a lot of burden on the providers, and that's why we're here. We're here to help make that a little easier and more cost effective.
Well, I would imagine at least the cash flow squeezes and everything. And I remember the old line from covering business stories for 40 years: cash runs the business. It's not profit, it's about cash.
Yeah.
So you're making it easier, I guess, to manage that.
Yeah,
cash
we're
flow,
going
right?
after the cash. We're trying to get that cash on behalf of the providers from the payers. So it starts from the time that the patient is seen. There's this prior authorization that has to get done, and prior authorization, the need for that, the payers have just made it very hard and made it much more cumbersome than it used to be. So now all of that has to get done, and then the patient is seen, and then it takes time for the money to come into the bank, and it's really it's very cumbersome process.
So you're making it easy for the doctor.
making it
Well,
so
the
that they don't have to
administrators
worry.
too. It's the whole
Yeah,
system,
yeah, it's the
right?
whole
So they
system.
can focus on the
You
patient.
you want
Yeah.
them to focus on the clinical aspect
Yeah,
of it and not
right.
have to worry about
The rest
all
of
of the
it.
other things
Yeah.
that are around it.
Exactly.
Yeah,
Right.
you're
Yeah,
absolutely
the
right.
term I
So
heard
you're their
recently.
heroes. You're going to be their heroes.
Yeah, that's what we like to call ourselves.
Yeah, the term I heard recently is pajama time, and it's doctors that have to finish their notes, and they wind
Exactly
up
right.
sitting up into the evening doing that to try to just catch up on the paperwork parts of their jobs,
100%,
right?
100%.
And that's just one example of where.
I mean, in fact, I
inefficiencies happen.
would love to talk about that example because there's some things in technology that are happening today to help reduce that pajama time. So
great.
we'll good. As we get into it, we'll talk about
Sure.
some
Well,
of
let's first find out where this came from. I'm sorry. Go ahead.
So may I mean, what about the globally? You're a global company. You're
Yeah,
a global talent. So how are you dealing with other countries? Can you little bit? Can we?
So we
just
all
a
our
little.
clients are domestic,
Oh, okay.
but
That's it.
operationally we do
Yeah.
work here in the United States
Sure.
for our domestic clients. But we also have nearshore operations in Colombia. We have offshore operations in India and the Philippines.
Mhm.
So we are hiring talent anywhere and
Yeah,
everywhere
sure.
that can help. Really take the cost out
The
of healthcare.
ecosystem everywhere.
We,
Yeah.
we want to take advantage of talent globally.
Yeah.
So you're offering the back office support services where you can access it
And
for
the tech, right? So
Okay,
today there are so many companies that are saying, okay, I'm building this technology, whether it's AI or whatever it is, right? I've got this tech. And then there's a bunch of companies that are services companies. So services companies are here, tech is here. Nobody wants to buy just the tech because then they got to figure out how to use it and implement it and use it to its best capabilities. And then nobody really today wants to buy just people or the service component of it.
Mhm.
What we do is we bring all of that together,
Sure.
right? And we're saying we're going to do the tech and the human in the loop component, and we're going to do it at a price point that nobody can touch so that we can, take that help in the efficiency of healthcare.
That's amazing. Where did the idea come from in the first place?
That's
Oh,
a top
boy.
secret.
Yeah. No, it's not a secret. So
It's not a secret at this point because you got it off the ground, right?
yeah. Well, so I guess I'll start with, you are right. I'm a Pittsburgh person, right?
Yeah.
So, but I moved here when I was 13. I was born in India.
Okay.
Yeah. No, it's okay. And I was born in India, but my parents moved here to the U.S. in 1970. And believe it or not, this is insane. You can't even fathom this now. I landed in the Hawaii airport, my mom and I, and my dad was already here.
Okay.
And they gave us a green card on arrival.
Wow. Okay.
In 1970.
That-
I mean, I was 6 months old. I don't remember it, but
Sure.
my parents tell me, like, we landed in the airport and they handed you a green card.
Wow.
Like,
That's
can
astounding.
even imagine
Forget it.
something like that?
Not at
Like, it's
all.
not a thing,
Well,
right?
the United States, we swing back and forth. We're in one of our, down on immigration phases. But you're right. There have been other times in our history when we wanted to promote great talent.
Exactly. And right now it's a little tough with the H-1B visa situation and paying
Are you
$100,000.
affected? Is your company?
Not really. We're not trying to bring people here.
Sure.
I mean, we do have a couple of folks that are in that process, but fortunately they're already in that process. So it's not retroactive. But yeah, I mean, it's a tough situation, right?
Yeah.
So anyway, so I came to the United States. I lived in a bunch of states. My dad took various positions through the years, and then he ended up here in Pittsburgh in 1983.
I'm glad he did.
All right.
In 1983, I was 13 years old, and he ended up in Pittsburgh, and I started high school here. I went to college here. I actually have 3 degrees in the University of Pittsburgh.
Oh my gosh. Okay.
I just stayed, and I ended up getting my first job at Bayer, which was called, at the time when I took the job, it was called Mobay.
Oh, it's still Mobay.
It was still Mobay.
The joint venture between Bayer and
Monsanto and
Sure,
Bayer, yeah.
The history guy.
He's been around, so he knows it. He knows
Nobody
Pittsburgh.
knows Pittsburgh like Bill does. Yes.
And then Mobay became Miles for like
That's
a
right.
year,
Miles
2
had their
years.
headquarters right here in downtown Pittsburgh.
Exactly,
yeah.
it's headquartered here. And then it became Bayer when the Germans got their name back, and they paid like, I don't know, $2 billion or something to get their name back, but they got their name back. But anyway, the company that's here, that's where I got my first job.
Okay.
Right. So,
Cool.
but I was not in pharma. Bayer's known as an aspirin company, a pharma company. I was
Right.
not in pharma. I was in their material
They're a
science.
big chemicals business.
They're a
They're
big
now
chemical
Mechanical
Covestro,
engineering.
Lanxess, the legacies of the
Mechanical
Exactly.
engineering to
Yeah, so that's
material science.
yeah. Well, that's kind of made sense, right? So
Chemistry got in somewhere.
yeah, it was a combination of I had an engineering background, so that's where I got my first job.
Yeah.
I ended up spending 11 years there, and it was a career where it
So you were in
spanned.
product manufacturing?
No, I started in engineering. I ended up running, and I will say that was probably the best thing that happened to me. I was really young. I was only, I think, 26 years old, and I got to run one of their business units.
Oh, wow.
Yeah,
So
I started young. It was
that's
only,
why the business bug bite.
yeah, that's actually was probably the one thing that helped me to kind of think in mindset of an entrepreneur. I had everything underneath me, and I was only 26 years old. I was very fortunate that I had that position, but I started young. I was actually only 19 when I started working at Bayer.
Wow.
That's incredible. Wow.
Yeah.
What an opportunity.
So yeah, I was 19. I'd graduated with my engineering degree. I got a job at
So you'd
Bayer.
already gotten your degree at that point.
I did.
Okay.
I
Right.
did.
So
I did.
you were a prodigy.
Yeah.
Definitely.
Not quite, but close.
No question there. So what has been the most important things you have done with your company innovatively? And if you can share some of the most powerful use cases using technology.
Well, and to get into that, what was that transition? You're working for this giant global corporation. You could have just, done the rest of your career with a local company like that. So
how did I get into this?
How did you get into this? And then we can dig into technology and what.
So in the late 90s, when the dot-com boom was happening, right? Everything, if you had a business plan that had .com on it, you could raise millions.
Oh,
right?
Yeah.
And a friend of mine said to me, what are you doing at Bayer? You're wasting your time. You're not German. You're never going to be CEO.
Got it.
So he said, why don't we start a company that has to do something with healthcare, technology, and India?
Okay.
He said, okay, what's that business going to be? He said, well, if you figure out a good enough business plan, like come up with something, I'll back it and we'll go do something together.
Wow.
And you are a born entrepreneur. You should not be in a corporate environment. Okay. But, a friend of mine, another friend of mine, she used to work for Kaiser Permanente, and she used to get these boxes of charts. Medical charts.
Okay.
She would take them, bring them home. This is back before scanners were even a thing. It's 99, 2000, right? So scanners are just getting in there. She would come home and she would literally on a piece of paper on the face of each chart write these numbers and letters. What are you doing? I asked her, like, what is it that you're doing? And she said, I'm actually doing something called medical coding. I am reading what the doctor did, what the patient came in for, and I am writing codes so that it can be submitted to the insurance company so that it can get billed and then reimbursed. I said, so how long does it take to learn this stuff? And she said, it takes a little bit. You have to do this for a while. You have to get it, formal training. You can't just, overnight know medical coding. But so it takes a little bit. So it clicked in my head. I said, okay, if I can, take these boxes of charts, I can get them electronic, or I can scan them.
Scan them in, right? I remember those days.
Yeah, I can scan them, and this is 99, right? It's the early scanner days. And I can get them to some really smart people in India to do this. I think I can build a business around that. And that was the impetus, right?
Okay.
To start the company to say, I want to try to do it at a better cost and allow the providers to do their business better. And look, this was a very mom and pop business. Medical, this is effectively what's called medical billing, medical coding.
Okay.
There were, back then, 2,000 companies that did this, and they were all very localized. Like, so if you were, looking for, if you were a provider group, you were looking for, this thing called medical billing, or now today, the term is revenue cycle, you were literally finding some local company that would come and get your charts and do
So
your
there'd be
billing.
somebody in Pittsburgh, there'd be somebody
Totally.
up in Cleveland, there'd be somebody else out in
Right.
Detroit
All over
or
the
down
country.
in Morgantown. It was playing out everywhere.
And
Yeah.
what started happening in the 2000s was this consolidation and more of a national, companies started to become more, hey, I'm going to provide these things more nationally.
Mm-hmm.
And we had gotten in early, right? And when I started Omega, this was in 2003, I did a transition from that first kind of idea to Omega in 2003. It was exactly that, provide these revenue cycle services, to the healthcare industry and try to take cost out, try to do things, overnight, right? When people are sleeping here, we can get work done, right? That was the concept, right?
Sure.
So we can do that medical coding in the middle of the night and reduce the turnaround and the cycle time and all of that. So that was my mindset.
That's
And
amazing.
it started with 2 people. And today we're like almost 37,000 employees today.
And most of them around the world, right?
All over the world.
All over the
Yeah,
world.
all over the world.
How many people do you have here in Pittsburgh to oversee
There's
all
a
of this?
few in Pittsburgh, but we have about 1,500 employees in the U.S.
Okay, all right.
And they're spread all over the
That's
place.
the thing with technology. You're all about dispersing all this activity.
We're all over the
and
place.
services
So
and
you were one of the early automation transforming healthcare, correct?
We were on the administrative side.
So
Yes.
workflow.
Mhm.
So what do you see as, with AI taking over, what do you see as the most powerful use cases coming out?
Yeah, you were doing all of this pre-generative AI
Yeah,
and the
well,
revolution
yeah.
that's been underway for the past few years. Right?
So our mindset has always been, if you don't have to have a human doing it, it's better. If you can use technology to reduce the number of people that you need to do something, that's been our mindset from day one. Now, we were very limited in what we could do early on in technology because computing power and all of those things, were not where it is today.
Back in the Stone Age,
In
the year 2000, right?
20 years ago, the Stone Ages. Yeah, that's exactly what it was, right?
Back at the turn of the century.
Exactly. So what happened for us was, AI has been there for a while. It's just,
the use of it.
The use of it, what we truly call the large language models now, and the use of technology and computing power and all of these things has just gone crazy. And it's the democratization of this has become, everybody can do it, everybody can use it now.
Yeah.
So we are always trying to be what I would call, innovative and trying to be, one step ahead. And I think that's what differentiates certain companies, right? If you are not constantly changing, you will become the dinosaur.
Of course.
And you will be
you're
always reinventing, and that's another kind of mindset. So, we looked at it and we said, okay, now that we have more and more technology, where can we take out, the human component of it? Because humans make errors. Computers can make errors, but it's less. And you even see it today, and I know there's a lot of buzz around, these robo-taxis and self-driving and all of that kind of stuff. I will tell you, and I own a Tesla with full self-driving. I came here today without touching the wheel.
Did you really?
It parked my car. And I paid attention, I'm looking, but the technology today and the computing power that's happening, millions of calculations per second, right? It's better than a human.
That's the thing. It's not
That's true,
perfect,
but
but
the
it's
human
still
being is
better than
unique.
most human beings.
It's better than most humans.
So that's why my question is, how is AI complementing human thing instead of replacing it?
Yeah. So, okay. So let's give so you asked for specific use cases in our industry, and then I'll talk about things that I'm seeing as well. So let's talk about in our industry. We are taking the encounter that happens with the patient, and we are effectively trying to make it as less human touch as possible.
Okay.
So we are ingesting that information into what we call a computer-assisted coding platform. So that thing that I talked about earlier, where my friend was writing those things on paper,
Sure,
on the
sure.
chart,
Yeah.
excuse me, that has become much more electronic. We're taking that electronic data, we're running it through, and the technology is saying, this is what I think the codes are. And it's spitting them out. And then the human is potentially looking at it. If you have a high confidence level, it's going straight to Bill. And if the confidence comes back saying, we think it's, 70% or 60% accurate, a human looks at it and it says, okay, I see a mistake here, or I see this, and it's continually improving it.
The AI will tell you how confident it is that it's right or not?
Yes.
Oh my God, yeah.
Okay.
Yeah, and you can set it to certain parameters, but it's either green and send it through because it's really sure that it's going to be right. It's
Powerful,
amber or yellow, and it could be wrong, or red, and don't send this through. Somebody has to review it.
Now, are you building these tools yourselves, or does somebody sell them to you? How do you access this technology?
So there are multiple companies out there building all these technologies, but we said we kind of want to do it ourselves. So we've been always very innovative in building things ourselves. We have 350 people in our technology development team, and we're not a SaaS company, right? We're not building tools to sell. We are building tools to enable ourselves to be more efficient. So when I go to a client and I say, hey, look, we can do this component for you, I'm utilizing technology, I'm utilizing labor all over the world, here in the US, in India, in Philippines, in Colombia, and I'm able to give a price point to my client base that is half or less than half of what they're paying today.
That's incredible. And I realize you don't have a whole lot of people here in Pittsburgh, but this has to be a great place to keep you on the cutting edge of thinking about both healthcare, but tech as well, right?
No question about it.
CMU is a great
CMU and University of Pittsburgh have a ton of talent. But the world is now, India has a ton of talent too, right? You've got all your big time colleges there. So, the availability of talent, young, very smart minds coming out of school that are, thinking. You've seen some of the numbers that are being thrown by Google and Meta and at young kids that are sharp.
Mind-boggling.
Friedman, who said the world is flat, something.
Right,
he said, you better
Thomas
eat,
Friedman,
olden days they used to say, eat your vegetables, people are starving. And he said, you better do your homework. People are starving in India to eat up your jobs. You know that? He wrote in that.
I mean, it's true. And we're very fortunate. We do a lot of business here in Pittsburgh. We have multiple clients that are here. We do work for Highmark, for Allegheny Health Network, for UPMC. I mean, so there's a lot that we know and understand just in our local market, but we are, all over the country. We do a ton of work for NYU, HCA, Vanderbilt. I mean, you name the health system.
You're doing health systems kind of everywhere in the United States.
All over. And then,
globally you're doing, right?
Yeah, so we have a lot of using global talent. We also have, a lot of large independent provider groups. A lot of them are private equity backed, dental service organizations. We have urgent cares. We have home health. We have, you name the area in healthcare, we're pretty large, right? So we cover all these different areas. Our whole thing is about give us the opportunity to improve your cost structure, improve your top line. Everybody wins, right? If you're improving revenue, you're reducing costs. I say this to our clients all the time, give us an opportunity to end up being quote unquote free for you. Because I can do it at a price point that I think you'll never be able to touch, and I will be able to, through the use of technology and our human in the loop, that we will be able to improve your revenue beyond what we're charging you. That's where we're trying to get.
So you're making a big difference on the business side and the technology side, but you did say you wanted to talk about pajama time. And
yes.
I presume that means how you're improving sort of the quality of the profession and the quality of life for the providers themselves.
Yeah. So there's a company right here in Pittsburgh that Shiv Rao started called Abridge.
Oh, Abridge, right, sure. Right. Know of them.
Abridge, or however you want to call it. And in other companies like them, there's Abridge, there's Suki, there's Ambience, Deliver Health. There's all these companies. I know the founder of Deliver very well. And what they have done is they're trying to reduce the pajama time.
Okay.
So today, when you sit in a provider's office, they're sitting there with their mouse or their iPad, and they're having a conversation with you, but they're sitting there looking at the chart, and they're clicking on.
Multitasking.
Yeah, well, what they're doing is they've got drop-down boxes, and they're clicking on this and clicking on this, and they're trying to create. They're charting. They're trying to create the encounter.
Sure.
So that can go to the next phase, right? So they can get billed.
Yep.
You want to have your clinician focus on you.
Yeah,
you
you're
want
looking at your eyes.
You don't want to look at you, right?
Watching your.
And then look back, look over, look back, look over.
Exactly, right?
What this is ambient AI.
Huh.
Okay? And what is now becoming more and more interesting is that the provider takes his phone, places it on the desk or iPad or whatever, pushes a button. Okay? And talks to you.
Sure.
Sits there and looks at you. And they have a discussion, so tell me about your family history, tell me about, what is your ailment, why you're here, what's happening. They just have a regular conversation. All of that is being listened to by the technology, by this ambient AI. And it is now parsing that data and putting, so you could be talking about a football game or you're talking about anything, but it's not putting that into the chart. It knows what to put in the chart, in what order to put it in, and it's actually doing that instead of the pajama time of the provider at the end of the day sitting there and looking at stuff and all of that thing. They are now right there, and then the chart gets effectively done. They just have to review it for accuracy and then move on to the next patient. So now you're getting a much better interaction. The providers love it. If the provider starts using it, they don't ever want to stop because it's reducing their burnout. They're not having to sit there and remember, oh yeah, I saw 2 Johns today. Which John had this?
Oh no, they conflate it if they're not careful, right?
Listen,
Sure.
it's a human errors can happen, right? In this case, you are getting that information right then and there. It's now creating that chart, and now if you order things or you say things in a particular way, the chart can be maximized for its documentation.
Wow.
So you're making it more efficient and human-centered.
Making it more efficient, making it also where you can improve the documentation up front so that you can bill at your highest amount of compliant revenue, right? You can get the most out of that.
And human-centered. You're looking more.
So how does that? So I understand there's startups springing up, and it's exciting to see what's been happening with a bridge here in town, and they're one of our unicorns, and it's really been a great story. How does that affect what you do at Omega? So you've got these new companies springing up, changing the way this is all reported. How then does that translate into what you do for all these healthcare systems?
Yeah. So for us, the most important thing is we don't want physical paper. So that's one thing that's
they're taking
improving.
that out of the loop at the front end.
The front end, but also things were getting digitized anyway, and a lot more has moved from paper that's getting scanned to now just electronic data, right? It's discrete data. It's coming. Once you have discrete data, you can use technology. If you are trying to OCR things and optical character recognition and there's mistakes and all of that. If you have discrete data that's coming into your system, then you can do something with technology. And this is the biggest problem. And part of the reason that I think healthcare is going to be still way behind everyone else is that providers, health systems, everyone they're very guarded on their data.
Sure.
And
rightly so. There's
privacy issues.
Yeah.
I get it.
Yeah.
But if you do not give access to things, you can't use the technology as much. You need the data to be able to use your technology. If you are going to be, just able to get into a system and look at it and not take it into something that's going to allow you to use the technology that you have, you'll be a little bit more limited. Health system compliance officers and CIOs are like, we've got patient-sensitive data. We can't give this to you. So that's why I think healthcare is going to become It's going to take a lot longer for healthcare
Sure.
to get there.
Okay.
But companies, getting back to your point, companies like Abridge, Deliver, others, they are now getting that patient and physician encounter. It's coming as data, voice, and then turning that into electronic chart. And then you're able to take that data and do more with it. You can get a prior authorization done, right?
Okay.
Because you have that information, you can ping that against, okay, we know this is the pair, we know this is what happened. Can we get a prior auth done right then and there off the document?
Instead of waiting days or whatever it might otherwise
We're
take
trying
to
to
run through
reduce the
system.
cycle time,
Got it.
right? And we're trying to make things more efficient. So all of these things are playing into it, right? So I need that clinical information in discrete data format so that we can take it and we can do that entire revenue cycle process.
Okay, got it.
From the time that the patient is seen till the time that the money's in the bank.
Really exciting. Kanak, we only
So
have
we
a couple
have
of
to bring
minutes
him
left.
back. We'll have to
Well,
bring
we
you
definitely
back
have to
if
bring
you-
you
That's
back.
okay.
But do you
You
have
can
a
do it.
couple? Have we missed anything you really wanted to make sure we
No, I
covered what
want
we've
to
got
know
in this
what
time?
advice you have for young entrepreneurs, coming into the field.
It will take you back to your youth, right? When you got into the, what did you
Yeah.
learn along the way that you could share with others thinking about, I've got the great idea, but where do I go from here?
Yeah. I think one of the things that I was very fortunate, and this is something that my father said to me. He said, I don't mind you being an entrepreneur, but I want you to go learn on somebody else's dime first. He said, come out of college, get a job, work at a big company.
Okay.
It didn't have to be a big company, but
Yeah.
he said to me, work at a big company, have them pay for your MBA, and I did that. And once you have that knowledge and understanding and you learn how to report to somebody and you learn to become accountable,
Sure. That's a good point.
you will be a better entrepreneur.
It makes sense. We tend to worship the 20-something dropout from a fancy university who somehow makes it big.
Yeah.
You don't realize that they're kind of the exception to
hard
the
work
rule.
in between,
And look, if I look back at why I feel like I've been able to, because a lot of entrepreneurs can only take a business to a certain level and they can't scale it, right?
Yeah.
They have a great idea, they get down
off
to
the ground, they can get investors, they sell a great.
And there's some people that are serial entrepreneurs that do that all the time,
That's
right?
all
They
they
go
do,
from business to
right.
business, they start another business, business, they take it to a point and leave. I've stuck with this. And the reason I think part of the reason I've been able to stick with this is I had an 11-year career at a big corporation with a lot of red tape. There was a lot of red tape in there.
Who doesn't?
But it was an incredible experience for me.
Sure.
It gave me the foundation. When I started something, I had to wear every hat. I had to do everything, right? My business partner and I, when we started this thing, it was literally, we would do everything. Now, I had people doing these things, right? But there was a time for many, many years that we did everything. But that foundation that I had allowed me to still stay with this business and be able to scale.
Mm-hmm.
And I feel that if I didn't have that, I probably would have tapped out at a certain point and would not have been able to be there. So my advice to young entrepreneurs, get a job somewhere out of college, work for someone, learn the ropes, learn how to be accountable and to report to people. And then if you have a good idea, you have something, you've got a foundation that I think will really help you in being a good entrepreneur, because just having a good idea, and it's being able to execute on it and then being able to scale it. And those are the things that's DNA.
Advice,
that's DNA that you're not just born with. You kind of have to learn.
Well, fascinating. It's a wonderful story. Yeah.
He has a secret talent.
Oh,
Where's your guitar?
Well, next time. Okay, next time he has to bring the guitar, you can use the drum.
He has got a very famous drummer in his band. His band. We won't tell his name now, but we'll invite him.
Yeah, I have a famous drummer in my band.
Yeah, and the whole gang. And
we'll just play next time.
Oh,
the whole band will get together.
A whole musical podcast.
Looking forward to it.
Absolutely. Thank you so much.
No, thank
you.
you.
Appreciate it. It's been fascinating. Congratulations. What a journey.
Thank
Right here
you.
in Pittsburgh.
Right
I love
here in
it.
Pittsburgh.
Thank you, Anurag. Thanks so much.
Thank you, Kanak.
Appreciate it.
Kanak, you want to close us out?
Yeah, this was a wonderful conversation on what is the topic we decided. Let me get that. You wrote it down. I forget.
Reimagining healthcare.
Did we even
So-
talk about the topic?
I know. This was the BioBeat podcast, reimagining
Reimagining
healthcare innovation, I forgot, AI and future of care. But there's one more to it. It said that we are rebuilding healthcare with
We
global
talked
talent
about that along the way.
and
I think so.
scalability using in the digital era.
Yes.
Touched on it somewhat, but please come back and
Would love to.
engage
Go a
with
little
us
deeper.
and
All right. Thank you.
educating the future generations on what all Pittsburgh can do, right?
Pittsburgh's great. Love this town.
Appreciate it. Thank you so much.
Thank
All
you
right.
very much.
Thank you.
Thank you, Bill.
Absolutely.
All right, see you next time.